Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Mixed levels of compliance to COVID-19 safety protocols are observed in some fun spots in Lagos as Yuletide celebration continues. And Imo government warns residents against complacency during festivities, ask indigents and travelers to get vaccinated. And Australia COVID-19 numbers surge as Omicron outbreak disrupts planned reopening of the economy. Thank you for joining us. Celebrate responsibly, get vaccinated and adhere to all non-pharmaceutical preventive measures to help curb the spread of COVID-19. That's the message from the Nigeria Center for Disease Control, which has last night reported 509 cases of COVID-19 across the country. Now, the Nigeria Center for Disease Control says the new cases were reported in 13 states and the Federal Capital Territory, with Lagos reporting over 500 cases. Now, here's more on the pandemic update.
859 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 13 states and the FCT. That's a drop from the figures reported earlier. Lagos accounted for more than half of the latest tally with 555 positive samples, FCT 57, Rivers 44, Plateau 43, Ondo 34, Kwara 23, Kano 18, Ogun 16, while Enugu registered 11 cases. Other states, including Oyo, Delta, Bauchi, Bayelsa, and Ondo State, logged a single-digit infection. The total confirmed cases in Nigeria now stands at 238,420. The report also includes a backlog of confirmed cases from Plateau State and 0 cases from Anambra, Ekiti, Osun, and Sokoto states. 220 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 212,770. There were 2 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,024. Currently, there are over 22,000 active cases in Nigeria, while over 3.8 million samples have been tested so far. More than 9.7 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4.3 million persons have been fully vaccinated. The total global confirmed cases have surpassed 281 million, while deaths are now beyond 5.4 million.
And fun seekers are still taking advantage of the public holidays declared by the federal government to celebrate and relax. It's a mix and match as regards the COVID-19 safety measures. Let's take a look.
The Yuletide celebration continued on its 3rd day in Nigeria following the federal government's declaration of Monday and Tuesday, December 27 and 28th as public holidays. And that's what these families are latching onto to make out time for family moments together, hanging out at fun spots and recreation centers. Father, mother, children, everyone finds a game that appeals to them. That's besides the family selfies.
Coming here to have a little fun, it just helps you relax your nerves and then to forget about things or the atmosphere of life that has actually troubled you.
Like I have a vacation, I've had a very busy year, and also give me the opportunity to relax, to plan for year 2022.
I really enjoyed it. I don't even know how to define it, but I was very afraid.
While the fun seekers take advantage of the moment, they say it is with a sense of responsibility, having in mind the COVID-19 pandemic.
There is actually nothing we can do right now. We just have to protect ourselves and make sure that while you're having fun, you're also staying safe.
Most times our children are locked up indoors. It's an opportunity to allow them to exercise their God-given energy and to feel free for once after the pandemic.
There is hardly any public facility that does not display the condition to access the facilities without observing COVID-19 protocols is the most prominent. In addition, some go on to enforce them. In spite of these efforts and the level of awareness, some fun seekers still disregard these safety protocols.
You know, Nigerians, we don't allow them to come in without face masks. But immediately they come in. Some, we try to enforce it that they must put it on. But an average Nigerian, I mean, being what they are, but we don't allow them to come in without their face masks.
For many, the public holiday, which ends on Tuesday, also puts an end to the fun. But then one hopes that this disobedience of COVID-19 protocols does not increase the number of Nigeria's confirmed cases days after the fun has stopped.
As shown by the ongoing coronavirus disease, COVID-19, major infectious diseases and epidemics have devastating impacts on human lives, affecting on a long-term social and economic development. On the occasion of this year's International Day of Epidemic Preparedness, the UN Secretary-General Antonio Guterres says it's a reminder that the world remains woefully unprepared to stop localized outbreaks from spilling across borders and spiraling into a global pandemic. Well, Dr. Shalom Oni is a public health physician, and he joins us here in Lagos to talk more about this. Thank you for joining us on the program.
Thank you for having me, Ms. Sam.
Well, before we go into the International Day of Epidemic Preparedness, I mean, I know that you've been traveling this holiday. What have you noticed in terms of, compliance to the measures?
There hasn't been any much difference from what we've been having since the beginning of the outbreak, last year. Some individuals are complying with the NPIs, the non-pharmacological interventions, out of ignorance, we're asked to do. Some do it for the cameras, for the photos, just to fulfill righteousness, while some other individuals are doing it because they have the understanding, of what it actually does. So I think we are still in the midst of the pandemic, and the government just needs to keep on ensuring that the right communication is out there, to keep on orientating people and encourage them, to apply with the NPIs. A thought came to my mind, we see a lot of checkpoints when you're traveling for tourism or to go to see loved ones and things like that. Why the law enforcement agencies are on the road, the FRC, the police and all that, why not integrate the so-called integration, when in the medical practice? Why not integrate their work and ensure that whoever they see, they ask, why are you guys not on face mask? For example, the police are supposed to do a check-in, the FRIs are supposed to access certain documents and things like that. So why not integrate that also? For me, it will help the compliance nationwide. So maybe that's a food for thought for the government, as we go further in this pandemic fight.
It also speaks to mind of the One Health approach, with,
exactly.
where, integrating all sectors
exactly.
in driving
the
this
human,
epidemic
the
away.
animal, and the environment. I know all these things have an interplay, and the disruption of life, between human, animal, and the environment can determine the occurrence of emerging diseases, re-emerging diseases, like we are now having with COVID-19,
right.
With Lassa fever, measles here and there, so.
And the truth is, with this, I mean, with COVID-19, do you think that the world learned the hard way about epidemic preparedness?
Yeah, for me, I think so, because if you look at it, even in developed nations, where we have the structures and systems, where we have the technological advancements, they were still overwhelmed, especially in the aspect of personnel. One of the ongoing brain drain is as a result of the overwhelming impact of COVID-19 in some European countries, on their personnel. So for me, I think it impacted every continent, but in varying degree. For me, for developed nation, the personnel and their and their equipment overwhelmed. For us in Africa, lack of structures and systems, non-functional. But however, the positive side is that a lot of countries have been able to learn one or two things. For example, when the pandemic started, Nigeria had, I think, about 4 to 5 genomic laboratories nationwide, but now we have well over 45, spread across, the nations, in northern areas, even areas we wouldn't have believed, So for me, I think there has been a lot of positive from it, but it came in a hard way. Now, not even talking about the economic implication. It has cut so deep into the budget of nations, voting billions of naira, billions of dollars, to fight. I was just reading through one time what United States did, in terms of their palliatives. They spent trillions, just to ensure that they cater palliatives only. So for me, I think we learned the hard way. And just like we said it was reported in the International Day of Epidemics that by now, right now, we have still not mastered what it takes to ensure that local spread remain local and does not go global. So for me, that's the food for thought for nations, especially African nations, to make sure that we still keep the structures, the systems in place, so that we can pick. The beauty of pandemic or epidemics or anything, or disease outbreak is that you can pick, the index case almost immediately, either from the port, or from the primary level or the grassroots level or from wherever. You can pick the index case, and from there, within 24 hours, you already marshal in your control system, then you marshal in your line listing system. Who are the individuals that this index case have had contact with in the last 24 hours. The beauty of it, that's the beauty of pandemic response, that you have a strong surveillance system that can pick, an index case. And for me, I think maybe Nigeria is due, maybe after this we are due for a simulation. We need to simulate our preparedness and see how prepared are we to combat, future pandemics, because this is very important for us.
Also, in terms of, the UN, WHO, other international organizations talk about solidarity, partnerships, and that this help also in combating and localizing outbreaks. Exactly. Are we getting that in Nigeria?
It's a good idea, and I think Gavi, Vaccine Alliance, the Global Fund, for AIDS, tuberculosis, and malaria, we call them ATM. I think this thing has been working well, but taking that back to Nigeria and how well we've been able to, how well are we doing as far as that partnership is concerned? For me, I think we can still do better. During on this ongoing pandemic, we've seen the partnership in our own domain here. We have COVID. Coalition Against COVID-19. So, and they did pretty well. Constructed, a lot of isolation centers across the nations, gave palliatives, even though the palliatives, we saw what happened in some of the palliatives, exactly. So, but then I think we are beginning to see the dividends of this partnership. But for me, I think it can still be better, in terms of funding, of research, funding of logistics, and making sure that materials get to the right set of people. So for me, I think it's not bad. Then we have seen the impact of Vaccine Alliance. However, there are issues on that. Sometimes the vaccines that we receive in Nigeria, they have lower shelf life. Their vaccines are already on their way out. And it caused a little bit of problem for us some weeks ago, whereby several millions of vaccines got expired, not due to our own laxity, but because the vaccines already had a low shelf life. So I think the partnership can be better. The solidarity can be stronger, can be strengthened. There should be a lot of sincerity, honesty to it, and there should be compassion, in all of it, so that there can be equality, among all the nations.
All right, we appreciate your time. Thank you so much. Always a pleasure having you on the program. Dr. Shalomani is a public health physician. Thanks again.
Yeah, thank you very much.
The Imo State government has warned residents to ensure that they take seriously all the protocols and guidelines of COVID-19 to reduce the spread. The State Commissioner for Health disclosed this while briefing newsmen in Owerri, the Imo State capital, where he says residents should be conscious and aware of the presence of the Omicron variant, as he urges the people to get vaccinated.
We want to reiterate to everybody that we do the simple things. If it is not necessary, please don't go out. Even when you go out, kindly keep some social distance. Wash your hands regularly, sanitize your hands with 70% alcohol-based sanitizers, and always be on your face mask. Avoid talking face-to-face to each other because of droplets while you speak. for most of those who are coming back, we also urge that they should be fully immunized. They should get vaccinated rather with the COVID vaccine. It's extremely very important so that we boost up our immune system. Rest well, be well hydrated, and do the necessary things. The Ministry of Health is being channeled to give the maximum it can give towards health care.
And it's still an opportunity for travel as some residents of Akure, Ondo State capital, used the public holiday declared by the government for the Christmas and New Year celebrations. Our correspondent who visited some parks in the city reports on some of the non-pharmaceutical interventions by some commuters and transporters.
Everybody's aware of the new variant that is out, so I believe we don't need to be told, we don't need to be forced to do what is right in order to keep ourselves safe and people around us. So normally I'll be fascinated, I want us to use it. But because of the new variant, from research, people that are vaccinated are getting contracted again. So I still have to protect myself.
They should talk more about it, and they should tell them the safety of using your nose cover and having distances in public areas. Because, you know, we have to tell people more about how these things spread, so that we'll be in a safer side.
You have to be able to sanitize your hands. You have to be able to use your face mask, and at the same time, the 6 feet distance. It is very, very necessary.
Away from Nigeria, the United States has cut isolation restrictions for people with asymptomatic COVID-19 from 10 to 5 days. Centers for Disease Control and Prevention officials said the guidance is in keeping with growing evidence that people with the coronavirus are most infectious in the 2 days before and 3 days after symptoms develop. The decision also was driven by a recent surge in COVID-19 cases propelled by the Omicron variant. Early research suggests Omicron may cause milder illnesses than earlier versions of the coronavirus, but the sheer number of people becoming infected and therefore having to isolate or quarantine threatens to crush the ability of hospitals, airlines and other businesses to stay open. And this is according to experts. Well, our Washington correspondent, Maria Bird, joins us right now for more on the situation. Hi, Maria. What are the COVID-19 numbers saying in the U.S. today?
The COVID-19 numbers in the U.S. today are going back to the height of the pandemic, unfortunately. We are seeing an escalated number of individuals who are contracting the Omicron variant. This is despite whether or not they are vaccinated or boosted. And so that is creating major concern for many Americans. It obviously disrupted the holiday season. Many had to cancel their holiday plans, gatherings with family and friends that they've not been able to do for almost 2 years now, just due to what seems to be a rapidly spreading virus. Yes, it is appeared to be that many individuals, especially if they are vaccinated or boosted, are not having the same type of escalated symptoms, but it is rapidly spreading very quickly and putting major strain, as I heard you say earlier, on the medical systems, and it's also putting a major strain on the ability to be tested. So now we are really having a shortage in testing for individuals who are looking and seeking some COVID-19 tests to be ensure that they are either negative or to know if they are positive and they need to quarantine.
We also understand that lots of flights, were cancelled over the spread of the Omicron variant. What's the situation with travel now?
We had almost 400 flights canceled just yesterday. There is a real reduction in the number of employees available that are running the airlines, whether or not they're out due to the fact that they have either contracted the virus or whether or not they're out because they're feeling overworked. We are seeing a real reduction in force for that industry. We're also seeing a major reduction in force in just our first responders. There are various firefighter units and industries across the U.S. that are seeing a 20% reduction in available firefighter forces just due to the fact that they are coming up positive with the virus. So we're struggling here with those first responders being able to stay healthy enough, which is, as you mentioned earlier, Part of the reason for the reduction number of days for quarantine, knowing that, as you said, the study suggests that either 2 days before or 3 days after you're most contagious with the virus, and knowing that individuals are oftentimes coming in positive but having no symptoms because they're either vaccinated or boosted. And the Omicron variant appears to be having a minimal amount of symptoms for those individuals who have previously been vaccinated and boosted.
So, but Maria, it's a bit confusing. I mean, last week, the CDC loosened rules that previously called on healthcare workers to stay out of work for 10 days if they test positive. The new recommendation said workers could go back to work after 7 days if they test negative and don't have symptoms. And then the agency said isolation time could be cut to 5 days or even fewer if there are staff shortages. And now, you know, it's changing the isolation and quarantine guidance for the general public. I mean, isn't this a bit confusing, especially for the back and forth and then, you know, trying to curb the spread of Omicron?
It's extremely confusing, I think, for the average American, especially those who've been working very hard throughout the pandemic to try to avoid their families being hit with the virus. And so this is putting major confusion, I think, on many American families and households and forcing them to make their own decisions about what's best for their families. We obviously know this puts undue stress on parents with children. We know there's an escalation in the number of children who are being hospitalized at this time, despite the fact that we have a vaccine available for those children 5 and up. But this is creating, I think, a bit of hesitation. But as we know, if the hospitals are strained and individuals are not able to care for individuals who become sick and who need to be hospitalized, then we are going to be dealing with an even greater issue with having individuals being at home in very grave conditions as a result of the virus.
We learned that New York City says that children will be required to show full proof of vaccination from January the 29th. Is this applying across the U.S.?
We'll begin to probably see that. We know California, the governor of California was the first one to state that he would be requiring vaccine mandates for children, for school-age children in public schools. So you'll begin to see with the very large school districts, and then you'll probably begin to see it spread throughout the country. Now we know states like Texas, many states in the Midwest, have not really adopted some of the same vaccine mandates. So you'll probably see those, either they will never adopt those mandates for their schools, or you'll see them come much later. But you'll begin to see it spread throughout.
And also the city introducing vaccine mandates for the private sector. I mean, how are they reacting to it?
The private sector is having a real challenge with that, because we know that many individuals within the private sector have said they're not going to be vaccinated. So what does that mean? That means a reduction in their workforce. And so that is creating, I think, what we saw where there was a bill put in place to say that the federal government could not mandate vaccines. And so you'll probably see the private sector continue to push back on that just so they can keep employees available to work, because there's a major, as we know, supply chain issue, but also available workforce issue as well.
Our Washington correspondent, Maria Bird, many thanks.
Thank you.
A Sydney lab has told hundreds of people they did not have COVID when they in fact had tested positive amid soaring infections in the area. The mistake, which took place over the Christmas period, was due to a data processing error. The Australian state of New South Wales is seeing rising infection numbers following the arrival of the hyper-infectious Omicron COVID variant. Officials say an increase in swabbing tests has caused massive backlogs. Some of those affected have expressed concern that they may have unknowingly infected their loved ones over Christmas. Here's more on the global update.
U.S. health officials have reduced the recommended isolation time for people with asymptomatic COVID-19 from 10 to 5 days amid a surge in cases. The measure is expected to reduce disruption caused by staff shortages in many areas because of infections. The Centers for Disease Control says most transmissions happen in the 2 days before and 3 days after symptoms develop, but experts have criticized the lack of testing requirements to end isolation. Over in France, from January the 3rd, remote working will become compulsory for those who can, and public gatherings will be limited to 2,000 people for indoor events. The news comes as France recorded more than 100,000 new infections on Saturday, the highest number reported in the country since the pandemic began. The new rules also include a ban on eating and drinking on long-distance transport. Nightclubs will remain closed until further notice, and restaurants will be able to provide table service only. However, there will be no curfew for New Year's Eve, and schools will reopen as planned in early January. Australia has reported another record surge in COVID-19 infections as an outbreak of the highly infectious Omicron variant disrupts reopening of the economy. And finally, authorities in China's northwest city of Wuhan have expanded COVID-19 testing for residents across the city of 13 million that is currently undergoing lockdown amid a rapid rise in infections. On Monday, the city reported 175 cases, up from the previous day's 150. No Omicron infections have been announced yet from the 810 confirmed cases in the region. China has reported only a handful of Omicron infections among international travelers and in its south.
You can visit our websites for more updates and a better understanding of the pandemic, plus other stories. It's channelstv.com, news at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.